My name is Sarah. I'm a 41-year-old woman living in Toronto, Ontario, and I live with an anxiety disorder and panic disorder. And I'm doing this video blog today to talk about my personal experience living with a mental illness and to try to address some of the misconceptions that I feel are very present, especially in, I guess, the social media sphere regarding mental health and mental illness. So what are anxiety disorders? Anxiety disorders are classified as a mood disorder. It's in the same category as depression. And anxiety disorders are disorders where a person experiences an immense amount of anxiety for little or no reason. And this is one of the important things to sort of clarify or differentiate from other experiences of anxiety which are not disordered and which are a natural part of the human experience. And I often feel that in the media, in the social media sphere, people confuse this mental illness with what I would consider and call, think about as mental injury, not a brain injury, but rather mental injury. I'll just give you a quick example of what I mean there. So, for example, there's a lot of things in the human experience which are terrible, which are harming, which are injuring. Loss of a parent, loss of a job, loss of a child. In the case of something like death of a child, if a parent experiences an immense amount of depression after loss of a child, that is a natural and ordered part of the human experience. It's not a disordered depression, it's an ordered depression. If someone loses a job and has an immense amount of anxiety around how they're going to pay the bills, where money is coming from, and fears about future, that is not a disordered anxiety. It's not an illness or a mental illness. It is very much a natural part of the human experience. So I really want to differentiate between what are emotions, healthy, natural emotions associated with the human experience, and emotions or experiences that happen from mental illness, and talk about mental illness as a disease process rather than as an injury. For some people, their experience of mental illness may be a short-term period, and it may be something that is treated or experienced almost like an injury, that they experience something that's very terrible. They enter a period of time of depression and anxiety that is natural response to whatever it is that they experience. They go through therapy. Sometimes they may have some drug intervention just to sort of help them over a hump, but ultimately they're going to heal themselves of the injury, come out the other side with the sort of ordered, healthy brain that they had before they experienced a terrible thing. For somebody in a disease process of mental illness like myself, there is no other side. There wasn't a beginning, and there wasn't a catalyst to mental illness, and there isn't going to be a magic cure or magic end to mental illness. It's a disease process in your body which science doesn't understand, in which we currently have a lot of different tools in order to try to live with those anxieties or to live with those illnesses, but we don't have cures, and in a lot of cases we don't understand why the brain has disordered itself in the way that it has, or why it's built the thoughts that it has, or why one person is more prone to have an anxiety disorder, to have chemical depression, than any other person. Okay, so what does disordered thinking actually look like then, if I'm trying to differentiate anxiety, which is disordered, from anxiety, which is a natural part of the human experience? Well, disordered anxiety looks like experiencing a pain in your shoulder for 2 or 3 days and thinking that you have bone cancer. And to understand it, you have to understand that you're not that the experience of anxiety is not thinking. You are not just thinking in your head, oh, I might have brain cancer. Maybe I have brain cancer. Or, oh, I think I have bone cancer. It's not a thought that's passing through your head. It is a fixated thought that will not stop, which is very loud, and which brings with it all of the experiences of anxiety that one would experience if they actually had a diagnosis of bone cancer or brain cancer. The thought of the anxious person that they may have this experience is so real to them and is so present to them that they experience all of the emotions that go along with the thought being true. So in that moment, there may be like a flush of heat that goes through the body, of an immense amount of adrenaline, fear that gets sort of pushed into the human body in response to the idea that it is at risk, or that it's at risk of being harmed. There may be an immense amount of sadness. There may be there may be an immense amount of nausea, which is associated, or even vomiting that's associated with like the absolute terror of having one's life threatened, or being threatened with a life-threatening disease. So when I say that as a person with anxiety, that I experience thoughts, I experience them with my entire body, and I feel all the consequences of those thoughts being absolutely true. Thanks for watching. I hope you feel like you know more about anxiety disorders and mental health after watching this than before you watched it. And if you have any comments or questions, just ask me. I'm a completely open book on living with my mental health issues. And if you know me personally and you want to talk to me about it in person, I would love to do that too. I would like to use this for something, so use me.